The monthly one-to-one process as part of our Go-To Head Physio system is a critical cog in the wheel to keep therapists focused, make sure they don't develop bad habits, but most importantly of all, start the process of building self-managing clinicians. So the monthly one-to-one process, it ties on and it builds on the weekly rhythm. So the weekly rhythm is the therapists get their weekly numbers. They then come to the in-service training with their clinical reasoning tools filled in, and then we redirect them. Now the truth is, if you get the weekly rhythm right, the monthly one-to-ones essentially should be plain sailing, because the weekly rhythm is the leading indicator, whereas the monthly one-to-one is essentially what happened overall in the past month. So it's a nice time to just pause and look back over the last month. Now, how we work it inside our Go-To Clinic Hub is the therapist will be given their numbers. They'll then have to input their numbers, and then they'll click a button, and then that'll measure them against the clinical standards. So they'll quickly see if they're on target or off target in certain numbers. Now, each number represents a part of the customer journey. So it's not just about a number, but it's all about the patient progressing, asking us for help, and actually delivering what they asked us for help with in the first place. So it's very much about the patient first and foremost, and a number represents if something did or didn't happen for the patient. So it's not just a random set of numbers. Now, once the therapist has those numbers, what they do then is they reflect on the past month, because we want to capture the learnings. And really, you're only ever going to learn something if there's a resultant change in behaviour. And many people, they can just go through the phases here, and they can just go through the motions and just go, okay, this and this is what I'm going to do. But actually the result is that there's no change in behaviour. And if there's no change in behaviour, then there's truly no learning happened. So the therapist must extract their learnings from the last month, and then identify how they're going to take these learnings into the next month and what that looks like on a daily basis. So I'm not interested in fluffy answers. I'm interested in the exact actions and the inputs that they're going to take in the treatment room that's going to result in the outputs, which is the Head Physio numbers getting to our standards of what we need, essentially. Now, they'll come to the meeting and they've actually thought about this, and they'll present the plan to Ollie, and then Ollie does two things. He either looks at the numbers and he looks at the plan, and he's either going to accept the plan or he's going to redirect the therapist. And how we redirect the therapist is we use a coaching habit again. So again, we don't just tell the therapist that, okay, you're way off of this, you're way off of that. We ask them questions so that they can think, they can process, and they can understand why we have said what we've said, so that then they can essentially come up with the plan themselves and own the plan. And so then what the therapist does is then they come up with their plan for the next month, and they're super focused on the things that they will be doing. Now, the actions that they're going to be doing are simple things that they can do in the treatment room, because as human beings, we're very, very good at stopping doing the things that got us to where we got to. And that's really one of the key purposes of the one-to-one. It's to reflect every month and make sure that we continue to do the good things that we're already doing. So Ollie will have that meeting. They'll go away, they'll get an email with their key points, and then they'll go and take action. And then we use the weekly rhythm again then in between for the next 3 weeks, in between the next one-to-one, to help the therapist execute those actions. So the therapist is super clear on the plan and what they need to do on a daily basis.
Talk about like 3 things I think I've done well in the month, and 3 things that I need to do better, and that's kind of the focus for the next month.
I think the monthly one-to-ones are very helpful. It goes through your numbers. So I do mine with Shane, as I'm over in Leeds and Shane's over here quite a lot with me. And we just go over like the numbers, how many initial assessments I've had, how many have we booked, how many packages I've sold, and just things like that. But then we kind of whiz over that, and then we just go into if there's any patients that I need help with. So my first experience was extremely helpful, just because I had the ability to talk about any patients that I'm not 100% confident with, or I don't really know where I'm going with them. So on a whole, I think they are a big thing.
It helps because we talk about the numbers. So we've discussed the numbers, they're quite specific, but then you don't just talk numbers, you actually talk about the actual people involved in that. So if someone's like not rebooked, it's kind of, is it something that was to do with like me and my physio abilities, or was there something external happening? And then if it was something to do with me, we kind of talked through it and like how I'd do it better next time. So yeah, it just helps you kind of realise what's happened and then how to kind of go from there.
I come out with more confidence in the patients that I'm seeing. I have patients that at times I'm not sure where to go with them, and then if I see Shane, I'll ask him at the time, but then there's others that I need to sit down and have a proper conversation with him. So it gives me the opportunity to do that, especially as a new starter. Back then, it gave me a lot of confidence coming out of them.
I had quite a brief period where I had quite a few of the similar cases. So I was getting quite comfortable with them, and then when I had someone come in that wasn't anything to do with that, it was a bit overwhelming, even though it wasn't a hard or complex case. It was just different to what I'd been dealing with for the past few weeks. So it was then just talking through it and realising, oh, I actually do know how to do it. But it was just talking about what happened, and I'm getting a few more sports type patients in, whereas I was having quite a few just general injuries, day-to-day stuff, rather than sport specific.
I think it doesn't really change how I work. It just tells me that what I'm doing is either being successful or unsuccessful in the case of getting people to rebook. I think my numbers so far have been quite good. I mean, Shane seems to be happy with them. So it just tells me I'm on the right lines with what I'm doing in initial assessments and follow-ups and things like that.
So once the therapist goes away with the plan that they've designed, they've bought into, they've agreed, it's up to us then as the leadership team to give them everything they need to execute that plan. And that's where they're really going to use the GoToClinic Hub. And one of the tools that they'll use on a daily basis often is the follow-up focus tool. So that's a clinical reasoning tool that I built because I noticed that a lot of clinicians in our program, they were really good at the initial assessment because there was so much structure, especially with the storyboard. Then it was the follow-up sessions where they lost that structure, their mind started to wander and it got a little bit scattered. So the follow-up focus tool is a purpose-built tool using our transformational physiotherapy principles to make sure that we're always working towards the next value outcome for the patient. So the therapist in between monthly one-to-ones on a weekly basis, then they'll be using the GoToClinic Hub, which has all the knowledge base. They'll be filling in the patient storyboards for initial assessments, but then they'll also be using follow-up focus tools. And if there's any patients that they're struggling with, they'll fill in a difficult patient problem solver clinical reasoning tool as well. And that just takes them through a process that allows them to self-manage. It'll ask them questions, it'll help them think through, it'll help them cut away all of the noise and really lock onto the signal of the root cause of that patient's problem and where they went off track. So they'll use a combination of those two tools, and then in the in-service trainings then, if we update any techniques with them, or if we give them any learnings, we want them to capture that. And that's then where they'll use the final tool, which is called the Clinical Excellence Capture Tool. And that's essentially a systematic and a very specific clinical after action report. And unless we capture the learnings, then that's not going to result in a change of behaviour. So they'll be using these tools consistently then throughout the weeks, so that by the time then they arrive to the next monthly one-to-one, then that we've given them the best chance of achieving everything they've said. So it's not just a case of here's what I'm going to do next month and then hope and pray that they can actually achieve it. We give them all of the knowledge, we give them all of the tools to develop the skills in order to achieve the outcomes that they said they wanted to achieve in the month ahead.
At uni, it would go back to what Dave says about the transactional versus transformational thing. At uni, it was and on my placements, I did all my placements in hospitals, and it was very numbers based in terms of how many people you were seeing. And they didn't really, not that they didn't care, but they didn't care as much about if they're rebooked or whatever. Whereas here, it's a lot of making sure that you're getting that treatment plan down, that you're communicating effectively, so the patients rebook and they trust in what you're saying. And then eventually you can give them the care that they need.
What roles does the hub play in your day-to-day work with patients?
Well, the hub has all the kind of exercises that ProSport has got kind of stored. So sometimes if you're losing a bit of inspiration for exercises, I can go on there and look, or if you're just not sure what to progress them with or something like that, it's all there, and it's really set out between each joint and stuff like that, so it's really easy to access and it's really quick to just find what you want. So I do use that quite a lot for exercises and what to prescribe people and stuff like that.
often do you find yourself using the hub during a normal clinic week, before sessions or like?
More before. So if I had a patient in, for example, with plantar fasciitis the other week, and I wasn't really clued up on how to go about treating that, so I used the hub a lot to figure out which avenue I should go down, how I should approach it and things like that. So I'd say I use it more before sessions than I do after sessions, but I definitely use it to help me. It covers all aspects of kind of what you'll need. So it covers the tissues that are going to be involved in certain sort of pathologies, exercises to do at the start of your rehab, middle and the end, your hands-on techniques. So it kind of gives you the tools to do pretty much most of your session as long as you're looking at it.
How do these systems help you become a more self-managing clinician?
I think, like I've just said, it gives you the tools to do every aspect of your physio assessment. I do still find myself going to Shane just to more not asking me what I'm doing right, just kind of tell him what I'm planning on doing, and then he just kind of says, yeah, I'll add all of this. But it just gives you the opportunity when Shane's busy, all his busy, Dave's busy, just to have a look for yourself and kind of figure it out yourself.
Once we've got the weekly rhythm good, and then we've got the monthly rhythms and the monthly one-to-ones good, then usually by 12 weeks in, that's the big milestone where therapists essentially graduate from our onboarding process. And that's always an interesting time, and that's where myself, Ollie, Shane will sit down, we look at the therapist's head physio numbers now, and then we come on to the performance pathway more long term. So essentially, for all intents and purposes, they've graduated from the onboarding phase, and now it's about now keeping them progressing, keeping them growing, and truly becoming go-to physios that can help even the most complex cases.